So for 2 weeks after your extractions, you should be eating a liquid mushy diet. Basically anything you can put in your mouth and swallow without chewing. Examples of that would be mashed potatoes. We'll fudge a little bit and say macaroni and cheese, pudding, jello, ice cream, scrambled eggs, soup, smoothies. Anything, again, you can put in your mouth and swallow without chewing, and is more of a dissolvable type of food. That way, if something was to get into one of the areas where the teeth used to be, the extraction sites, it will be more easily rinsed out, won't get stuck, and then you will have less of an infection. I want patients to think that this diet is like crutches. If you have a surgery or procedure on your ankle, you're going to be put on crutches, and you want to be on those crutches for as long as possible. That's how this diet is. Think of the diet as crutches. The normal course of healing after a tooth extraction or wisdom teeth is typically the peak for pain and swelling could be around day 3 to 4. It will level off on day 5 and start to improve on day 6. That's on average. Some people, that will be day 2 and 3 and level off on 4. Others, it's day 3 and 4 and levels off on 5. Somewhere around there. Hopefully you cruise through it and you don't experience that, but it's very typical to feel pretty good the day of and maybe the day after, and then a little bit more pain and more swelling before it gets better. So after having extractions or wisdom teeth extractions, it's really critical that you take it easy, and we tell people we really don't want any hard physical activity, not getting your heart rate up high, sweating for about a week. It's critical that you come back to the office 5 to 7 days after your procedure for us to take a quick peek. And at that appointment, we will show you how to flush out these sockets. Although you're already doing your rinse, we're actually going to give you a little syringe that you'll use to take and flush out the food that are still remaining in those holes, just to keep it clean. Very similar to if you skin your knee, you want to keep the dirt out of the cut will heal. That's what that post-op appointment's for.